This is Day in the Life, part of a series of videos showcasing the amazing diversity of health-related jobs. In these interviews, we'll hear a little bit about what a day in the life of a health professional may look like. We will hear perspective from a physician leader who has devoted her career to championing for and working on the front line with those who have disabilities.
Hi, I'm Kristi Kirschner. I'm a physician in rehabilitation medicine. We're also called Physiatrist, a specialist in patients with disabilities. For the last 5 years, I worked here at Schwab Rehabilitation Hospital, which is a safety net hospital. Safety net hospitals are hospitals that care for poor patients, care for patients with publicly funded insurance, or even patients who are uninsured. So here at Schwab Rehabilitation Hospital, we have a lot of really neat features to make sure that our patients can get full access. We have big examination rooms with 5-foot turning radiuses for our patients who use wheelchairs. We have high-low tables that patients can use to transfer onto an examination table with minimal or no assistance. We have wheelchair-accessible scales. It's incredibly important that patients be able to get weighed, particularly if you're pregnant. Weights are one of the most important things that we monitor during pregnancy. Basic access is one of the most important needs of our patients. Many of my patients, when I started working in rehabilitation 25 years ago, were not able to get onto an examination table. I was very interested in reproductive health care services for disabled women and found that many of them weren't getting examinations because they couldn't get on an examination table for their pap smear. They couldn't get a mammogram if they couldn't stand. Many of the doctors were simply uncomfortable with the disability-specific needs. So a lot of my work, actually since 1990, has been to educate healthcare professionals about their obligations under the American with Disabilities Act. I do a lot of advocacy and education work around healthcare access for people with disabilities, so people don't have to come just to a rehab hospital, but they could go to a general OBGYN office, primary care office, and be able to get these healthcare access needs met. As rehabilitation doctors, we are concerned with the whole person. We're concerned about the body, we're concerned about the mind, we're concerned about the person and their physical environment and their ability to participate in society. Since I've had patients now I've cared for 25, 30 years. I mean, what an incredible privilege to have started working with somebody at the onset of a new disability and to be able to see their life transformation over 30 years. So that's the way I like working with patients in the context of, structuring their life, living with disability, and making sure that they're getting their healthcare needs met. So in rehabilitation, we take care of patients who have disabilities from traumatic causes as well as acquired disabilities from diseases. So we're a trauma center here at Mount Sinai Hospital, and we see a lot of patients with gunshot wounds, might cause spinal cord injuries, traumatic brain injuries. We see patients who have acquired disabilities from strokes or vascular disease. Patients may have amputations from peripheral vascular disease or have diabetes, COPD from chronic smoking. So we see patients with a broad variety of disabilities from both acquired as well as traumatic causes. I also take care of patients who have congenital disabilities. So these are patients who were born with their disabilities or acquired them early after birth. That might be cerebral palsy, spina bifida, patients with neuromuscular diseases like muscular dystrophy or spinal muscular atrophy. So one of the really interesting things about practicing in a safety net environment is the number of patients we see here who have acquired disability as a result of violence. There's a high rate of gang-related activity, substance abuse, and there are a number of people who have gunshot wounds that we see here. So it's a prominent part of the culture that we're dealing with, violently acquired disability. So again, as a disability doctor, I'm not an internist or a primary care doctor, but I try to make sure that my patients are getting those care needs met, any specialty care needs met, and that we're coordinating all of those needs over a lifespan. So I may be the person that helps them evaluate their equipment, evaluate their specialty care needs, make sure that they're connecting with the right healthcare professionals. But I will have a relationship with them and oftentimes with their families over many, many years.